Good morning. It's a big pleasure to be here speaking at the ITI World Symposium 2017 in Basel about predictable results in staged bone grafts. Our learning objectives for this morning are, number one, to understand surgical concepts that may influence the outcome of staged bone grafts. And number two, to identify clinical situations and procedures to obtain a more predictable result when performing staged bone grafts. So what are the primary objectives of ridge augmentations or bone graft or staged bone grafts according to the ITI treatment guide number 7? Well, number one is to obtain function, meaning to create a volume of vital bone that will accommodate a dental implant of sufficient length and width for its ideal restorative and functional position. Number two is aesthetics, to give the associated soft tissues the bony support needed for an aesthetic appearance of gingival, mucosal, and facial structures as well. And number three, have a good prognosis, creating sufficient bone volume currently around the neck of the implant to cover the endosseous implant segment, ensuring a tight soft tissue seal and a predictable long-term prognosis of the implant. As secondary objectives, according to Cordaro and Tarhadin, is to keep the surgical techniques straightforward, do not make inventions, minimizing surgical and post-operative burden to our patients, reducing the number of surgical sessions, meaning that even if it's a small intraoral bone graft or a big, large extraoral bone graft, we need to keep cost, healing time, and predictability under control. So number one, digital imaging is really important because we need to know exactly how are we going to conduct the bone. So number one, all bone grafts should be restoratively driven. So we need to know where should the future teeth be. And number two, where is the available bone in relation to the future teeth.